Welcome to the Living Medicine Podcast, where we talk about ethical medical use of psychedelic psychotherapy, teaching skills, examining the issues, and interviewing interesting people. Now let's start today's show. Hey everyone, it's Signe. This is the beginning of a podcast series that we're putting together where we're interviewing actual clients who went through ketamine-assisted psychotherapy in my practice or in some of my colleagues' practices. So you guys are really fortunate today to hear from the voice of an actual participant, and we're planning to do more of these. So today I'm joined by a client that I saw a couple of years ago. I'm interviewing her now about 2 years after she completed ketamine-assisted psychotherapy as part of her psychiatric treatment through our clinic. This client is someone with complex trauma who is a childhood abuse survivor. She also is a survivor of institutional abuse that occurred during a residential treatment stay when she was an adolescent. And you will hear her referring to that in the interview. So I just wanted to let people know if that is heavy content for you as a listener. Though we will not discuss her trauma in detail, she will make references to that. This residential treatment trauma abuse happened in a treatment center that was later sued for this very thing by other young women and has since been closed down. This was not a wilderness program, but a residential stay center. So she experienced childhood trauma in addition to this experience as a child and an adolescent, and had a diagnosis of complex trauma. So you will hear her referencing those things in the conversation. So I am talking about her in the third person here because we've agreed not to use her name, and we are also going to blur her face for privacy. By the time this episode airs, she will have had the opportunity to review the footage. So any references she makes to other aspects of her life that you hear that may be somewhat identifying are things that are okay with her, and she's agreed to include. So I want to thank her for being part of this. It's a really a privilege to have these conversations, and it's a privilege to offer these to you as the audience. So without further ado, let's start and get her on.
Hello. Hey.
Hi.
Hi.
It's recording, but we're going to talk about later what parts you want to use. But
Yes.
How are you? Like, do you have your needs, like your body, your hydration, your food, your rest, all those things that okay?
Yes.
All right. So what we're going to do, I basically just want to ask you about your experience.
Yeah.
And what I'll do is I'll chop out pieces of this conversation and put them together for a podcast, or maybe you with some other clients, or maybe just you. Well, it'll be put out in some kind of form. So
Yeah.
when we get to the end of this, I'm going to ask you, is there anything that we shared that now that you're thinking about it, you would like me to cut out? You can let me know. And then also if afterwards, if you think of something.
I mean, like, and you know this about me, obviously, we've been working together for a very long time, and my entire life I've been incredibly transparent. Certainly there are obviously like, we're right. Like I'm a very transparent person. Yeah. Certainly there's more like private things that I certainly, you know what I mean, that I like wouldn't want floating around a ton. But at the same time, I think that at least like my perspective and what I've always told people about why I always have been so open, besides the fact that like I just knew that it was helpful to talk about, was because like I don't look like the picture of mental health, you know, like of a true, like of what people consider somebody is mentally ill, or like because I see high functioning or things like that. Like I feel it's not more important, but certainly important to make sure that people know that like the representation exists. Like there are very high functioning people that really struggle in their own head, right? You know, so I don't really have much reservation per se about like having a lot of my identity, you know what I mean? Like I'm kind of like, as long as people can't really tell it's me, you know, or like really identifying stuff, I don't really care.
Okay. So it's okay if your voice sounds like you.
Yeah.
If you listen to you, be like, that is my voice. Okay.
Yeah.
I think that's actually a really important message. Like exactly what you named is one of the reasons that we are sort of doing this project, is because like you and others, you're kind of some of the first generation of clients to experience ketamine assisted psychotherapy. And wouldn't it have been nice if you could have listened, like had some other people to talk to about it first? Like, what was
Yeah.
it actually like? Or, so the idea is to kind of put that resource out for people.
Yeah.
The good, the bad, the parts that were comfortable, the parts that were not, like just whatever you would want to tell a friend
Yeah.
about it. And just to have more of those voices out there so that other people who are interested in it or are considering it have that resource.
Of course. Of course.
And I hear you that part of like what you're naming is there's an assumption that people doing this are like, maybe I don't want to put words in your mouth, but maybe like really low functioning or
Yeah.
something. And that is not at all what's going on.
Right. Right. Yeah. They're
I
just like
agree.
people that are like seeking drugs or, you know what I mean? Like things like that. Like I think that ketamine, I will say that in a positive note, like most of the people that I talk to, because I talk to my coworkers quite a bit about like my ketamine therapy and things like that. And most of the people that I talk to seem to have some understanding that this is a true like medicinal value. And I do hear mostly interest rather than kind of like adverse things when I, like explain that I've done this with people and stuff. And I feel part of this why I wanted to do this is because I feel very passionately about what you're doing and how this drug really impacted and like changed my life. So for sure, like I would love to be able to
Why
share
don't
that.
we start with that then? Like, how do you feel like it impacted you in your own words? Like, if you were explaining this to a friend or a colleague that was just not understanding what it is at all, because it's kind of weird stuff.
Yeah. I mean, it's so like I think about the two like major things that stand out to me about it per se. Like, so the first thing I think about the depression protocol that I did, and in some ways, that was slightly aversive, right?
Yeah.
And it was painful. It really was. It was actually not per se the most pleasurable experience. That being said, it completely changed my life because it allowed me to go back and actually think about what had really happened to me. And I had been suppressing that, and my brain had convinced myself and my body that that was irrelevant and like gaslit myself, and that was not the truth. And like, granted, my brain and my body like protected me and saved me from the grave depravity of like the situation that I was in. And like, I couldn't have survived that situation if I understood to the extent what was happening to me. And like, I think even like, I don't know if we've ever like directly talked about this, but that just like the degree of like, I think my body just couldn't make sense of what was happening to me. And that's when I first started taking like those thyroid tabs and everything. Like it was prescribed to me by the physician, by the psychiatrist there because I was blacking out when I was standing up.
Oh,
And that's when it all started. And like, I just think that I would not have survived that time if my body did and my brain did whatever it could to keep what was really happening away from me. And I'm so glad that I did the ketamine when I did because like I needed to get over that. I really think that on some deep level, it was disturbing me. There was a great like misalignment and it just wouldn't have worked out any other way.
yeah, that's powerful. Because it sounds like let me ask you, but you're making a connection between physical symptoms you were having in your body and trauma, but that you were not really conscious of that trauma or not really allowing it to bubble up to the surface at all. And what I think I hear you saying is ketamine was painful because it sort of dredged that up. And that is not pleasant at all, right? That's like an understatement.
Yeah, no, I mean, it was like
Yeah.
for somebody who generally doesn't feel a lot of anger, the rage at which I felt at the time that it happened, like it was amazing. I just like I was so beyond irritated, and the only explanation I have for that is just the true frustration that I felt at being just I guess in another institutional abuse situation. You end up in the exact same situation again where something is not right, but I knew nobody would listen. So I didn't even, you know what I mean? Like, why would I even try? There was no way for me to survive without putting it away somehow.
What was your experience of how that showed up on ketamine? I know it's hard to put those things into
Yeah.
words.
I'm trying. So like, I remember the first, so it was like the six infusion protocol. Is that correct? It was like 3 per week.
You did 2 a week for 3 weeks.
True. Okay,
Yeah,
that's what it was.
induction in what we call an induction series. And at that point time, like you said, you were on it for symptom relief,
Yeah.
not
Yeah.
psychedelic assisted psychotherapy. Yeah.
Right. But ended up happening kind of anyway.
And then we moved you over into that model after
Yeah.
that.
Yeah. So yeah, so I remember the very first infusion I ever had, right? Like they went kind of, I think the drip was really slow and they went kind of easy on me. And I remember um, it's weird. Like whenever I go, especially when I'm on IV, I can't say that I felt this like on IM per se. But like in IV, because it's kind of a little bit of a slower like drop into it, like I felt pretty like safe and comfortable. Like I felt kind of like wrapped in a warm cocoon and I had a weird awareness of like the room around me, which I think I kind of talk about generally. Like when I do you kind of mean or like I have a weird awareness of the building around me and kind of like you get this weird awareness of like the impertinence of it all and like kind of how it's just a little bit of like a, it's not as straightforward, right? You start to
Yeah.
begin your like perception of what is reality kind of, like kind of begins to become more fluid. And I liked like my first drip. Like it was like, oh, I like this. This is kind of comfortable and safe and whatever. And then it was after we discussed that protocol, I think is when we decided to increase it. And I think about maybe halfway through the drip or like towards the end of the drip, like I just started to feel rage, like just so much rage. And like I remember just kind of like trying to keep myself even and like not like kind of like I came out and like not trying like lash out and stuff. And I was like, something is wrong. And you were like, oh no, like this happens. And then um
That's
and
interesting. Like, oh, go ahead.
no, one just that. So pretty much like I remember finishing out the series and then I think the like sadness of it started to set in like once the actual like rage. And I think that just like it felt like it dropped the subconscious door between what had actually happened and then my like conscious understanding of it.
Yeah, that's fascinating. And also just to honor the fact that that's like super painful to go through.
Yeah.
Yeah. And I remember it being dysregulating for you. And so it's interesting. I haven't, like you said, you and I haven't actually had this conversation kind of
Yeah.
like in this way. And all of this was a while ago now. Like
Yeah.
we were talking,
Years.
yeah, years later now. But it sounds like you look back on that as kind of like maybe reopening that wound or something. Is
Oh,
that
for
right?
sure.
Okay. And then it's sort of forced you? Is that to work on that wound in a different way, or you almost it just brought it to the surface?
I
What did
think it
it
was
do like for you?
I think it was part of it. Like it was a wound that I didn't really know that I had was what was kind of so sad and so scary about it. Because like I said, like I think that when I got there and and the real part of me realized this is really fucking bad.
Hmm.
That had to go like hide far away because if I were to recognize the grave magnitude of what I had been experiencing, like I don't think I would have mentally survived. And I don't think that like that part of me that went away that knew what had happened would never have come up. Like that is truthfully how dead and buried and like tucked in the far corner of my brain it was. I had no idea that I really had these terrible feelings about what happened there.
Yeah.
No idea.
Wow. Well, that's big. That's
Because
pretty.
I couldn't accept it. How could I accept that I had then just spent another few years of some of the most like important developmental years of my life trapped in this horrifically abusive situation where I knew nobody would listen to me. Then I get out and on top of it, I had plenty of reason to believe people wouldn't listen to me like when I was in step down. And I was telling them that my house family was abusing me. I was telling my therapist that my house family was abusing me for weeks. And it wasn't until I had physical proof of text messages, of voicemails she had left me, that they finally believed me and pulled me out of the house. Nobody believed anything that I ever said. So how could I have said, why would I have said it? Why would I have named it? Why would I have acknowledged it?
Hmm. And some deep part of you, A, knew it, and B, had a lot of rage about that. And that was your sort of introduction to the fact that all that content was in there.
Yeah.
That's showing up on ketamine. And I guess we should name this as after many years of you engaging in therapy.
Yes. Yeah.
Good and bad and all types, right?
Yeah.
What was your journey with that content afterwards? Because I know that we did other ketamine, more facilitated ketamine sessions, but I also know that you did a lot of work with that in other ways yourself too. And I
Yeah.
think it's an important thing to say because just because some challenging content comes up on ketamine doesn't mean you can only process it on ketamine.
Oh, yeah.
You can certainly start working with it in your life. That's what we call in the biz integration.
Yeah. Yeah.
um, is figuring out what it means for you. And then what was that like for you? And if you did dip back into ketamine work with that work, did you do that or not? And if so, what was that like?
Yeah. So I remember like, if I remember the progression of the year, I like did that. I did that series of infusions and started to feel the rage. And it took me, I don't remember exactly how long, but it took me a little bit of time to make the connection even between like the anger and the fact that it was like treatment. And then that was the period of time in which you, Lisa, my mother, and I spent a lot of time deciding whether or not I was going to go back to residential. And remember, we like interviewed a few program directors, and we ultimately decided that just due to the degree of like institutional trauma that I had, that was not a suitable situation for me because I just wasn't going to be able to feel safe in like a removed home environment where people had control. Like I couldn't let go of that. And so, and I know that was like, we were all concerned about my level of safety and things like that. And I had immense amount of had immense amount of gratitude for both you and Lisa in being able to find a way to hold space for me in an outpatient setting to do the work. And so I started working with Lisa twice a week on an outpatient basis. And I spent that year, to be completely honest, I actually don't have a lot of recollection of
It
like
was
what
rough.
was the true nitty gritty. Yeah. Like what was the true nitty gritty therapy that happened other than like I survived that year by the skin of my teeth. And like, I literally, I mean, Lisa can attest this. I went and sat in her office and started every single session out by saying, I don't want to be here.
Yeah.
Like,
I think it was incredibly hard. And it's, this is something that's interesting, I think, for people who may listen to this to hear is like you're describing maybe a cautionary note about ketamine, which is it can open up stuff, right? And you can't necessarily just go back to your life and put it back in the box after that.
yeah.
And so this might be an argument for, having more access to preparing ahead or just knowing like you need a lot of support around you during the integration process that can happen afterwards. And even though it's not that explosively like it doesn't do that for everyone, it does for a lot of people, right? And especially people with trauma history, which is so many of us.
Yes.
That things will show up on ketamine that we weren't prepared for or hadn't really even consciously registered was a thing for us.
Yeah.
Now it's there. Now all of a sudden it's at the surface. So it's an argument for why you need a therapist.
Yeah.
Or somewhere safe to land. There's some way it's someone to process all of that with. Because that was really hard. What I saw you, just the parts I saw you through.
It's crazy. Like I look back at like pictures that I took of myself during that. I have camera rolls of selfies that I took of sitting at my house in Black Mountain, just sobbing. Really? Because I literally was like trying to like make sense of like my life and what had happened to me. That being said, though, like looking back on it now and experiencing what I experienced this past year with my mom and Greg and everything, like I know hands down, I would not have been able to handle this past year of my life, this grave magnitude of trauma that was literally happening at every single moment of my life for the past year plus, because even after the hurricane, like I would not have survived this period of my life had I not done that work and had such a great understanding of myself. Like that literally saved my life going forward. And I would do it 7 times over because of how much relief and understanding it brought me within myself, just overall from doing all of that work. Like it was incredibly hard.
Yeah.
And during it, would I have agreed to do it again? I don't know. But in retrospect, it was beyond worth it.
Yeah, you almost got thrown into it in a way, right? Without even knowing all it was going to be that intense.
Of course, because
Yeah.
we did the depression protocol, or like my understanding was it was to help with my symptoms, right? But it actually exacerbated them, but in a way that was like necessary. It just didn't obviously feel that way at the time.
Yeah, I think, and you and I have talked about this, but what we believe goes on with this is that prior to that, you were carrying all of that trauma already. So you were feeling symptoms related to it and you were struggling from it. It's just that your brain didn't connect it to that. So you saying that you've coped with this past year, which has been a year of immense loss for you and grief and transition, better than you would have then, makes sense in the sense that like you are going through that as someone who's not also carrying around a whole bunch of subconscious unacknowledged trauma that's living in your nervous system.
And
go ahead.
And it's the true like bodily autonomy awareness, because the other element of like the ketamine work that we haven't even talked about that's like huge for me personally is like the work that we did in relation to like the physical sensations in my body, and just like not only becoming so emotionally like intimately aware of like my subconscious self to the best that you can as being like the conscious being or the conscious side of it, but also being able to shift as somebody who like could not identify more with the body keeps score, like being able to shift some of those body sensations and some of those like deep traumatically held like energy aspects in the body, and like that work that we did where like you would put pressure on my chest and like you can ask me more questions, you can elaborate on that, but that between not only like being more aware of myself emotionally and truthfully understanding myself more in that way, but also being able to not physically hold on to those things in the same way that I had in the past, I think really like made this year that much more tolerable. Like all like there's not only like being able to like let go of that trauma, but also just like in real time, knowing myself better and being more aware of that was really impactful.
That's so interesting. Can you, like, how would you explain to a friend what you're talking about with the body stuff? Right.
Yeah. So like in the most simplistic way I can describe it is like so I've always had a good awareness that I feel things like in my chest, in my body, and it always centered around my chest. I feel everything in my chest, but at different sensations in different places and different like textures and things like that. And I also like have really bad, like I get really like locked into positions. Like I joke with my chiropractor all the time. Like every other session, I always say, like, I literally am the living embodiment of the body keep score. And he cracks up and laughs because it's true. Like the way that my body locks up, it'll be like clockwork in the same position, even if he adjusted it, you know, like the week prior. And when we were doing a ketamine session, sorry, I need a tissue. One sec. um, okay. So with all that awareness, when we were doing the ketamine, an IV ketamine session, it wasn't this past year. I think it was the year prior. I think it was literally the year before this all happened.
It's been a while. Yeah.
Yeah, it was the year prior. And things were kind of like somewhat even in my, you know what I mean? Things were kind of somewhat even in my life. And we were in, you know, I'm like in the process, and I mentioned like the chest pressure or like something to do with the chest or whatever. And you were like, you know, are you okay if I try and like hold it for you? And I was like, okay. And so, I mean, I had been describing this sensation in my body up in, you know, at this point, what, like 2 years ago for like 25 years of my life. I've been experiencing this sensation, describing it in great detail, and never felt it shift in my body. Like it always was just like this uncomfortable thing. And you came over and held pressure my chest, and I felt it release for the first time in my entire existence.
That makes
And I
sense.
never and I never thought that would change. Like it was so crazy to feel like my body truthfully understood, you know what I mean? Like there was a deep body understanding that it did not have to hold that in that same way. And it was a progression, right? Like that was the first, this was another great, example of the integration of this, because it was that work that I then took and started working with that trauma informed yoga instructor about.
Mm-hmm.
And
Yeah.
all of a sudden, in the months after that, repeatedly, week after week, I was able to get that sensation to shift in a sober state in a yoga practice. And it was like, it was totally life changing. I needed less adjustments from the chiropractor. Like, I was able to get more movement on that stuff with myself. Like, I didn't know that I could feel like kind of less sick in my own body. Right. So that was a huge element to me.
No,
Um,
that's a
yeah.
beautiful way to describe it. So you felt in that moment the shift, like it's almost like your body did something.
Yes, absolutely. It was like, I'm trying to think, because I mean, I remember it vividly. Like I remember that whole session very vividly. And it's like, I guess, so like I would always feel it kind of like constricting. It was like so much energy and pressure, like constricting inward, right?
Mm-hmm.
Like it was almost like I couldn't breathe or whatever. And then when you put the pressure on my chest, it wasn't like the energy entirely dissipated, right? Like that's not necessarily what it was. It was like and then it just kind of felt like it radiated outwards instead of inwards, right? Like it wasn't like the energy was like trapped within me per se, it like had more room. You know what I mean? It was like, oh, we don't have to stay, I guess, just within you. Like I think it was kind of like, oh, like there's places and other spaces and people that can like hold this too, I guess in the most simplistic
Wow.
way.
That's super interesting. I've never asked you about like your really inner experience of that.
Yeah.
I remember it, obviously.
Yeah. Yeah.
Yeah, I remember you and I having some conversations in integration afterwards about ways to work with that physically in your body.
Yeah.
And I think that working with someone like trauma informed yoga, that was like one of the ideas you had. Like, I think I remember us talking about how the body is working through this
Yeah.
and honoring that and like creating some sort of space for that to show up in a way that's safe and work with it. And you did that. You sort of found that route on your own as part of your integration process.
Yeah. Yeah. I don't know. I truthfully, between like the ketamine slash therapy work that we did, kind of prior to that, and then the like trauma informed yoga and like really being able to learn how to shift like energy in my own body in that way, those are literally the two things that I credit with saving the past year of my life. I have absolutely no doubt that I would have been in and out of the mental hospital while dealing with my dying mother and my dying cat, which would have been
Mm-hmm.
absolute fucking nightmare. It would have been a nightmare. And I'm so there will never ever ever be a day in my life that I don't have great gratitude and everything for the people that helped me do the work that I was able to do to like not be destroyed
Yeah.
by the past year of my life, because I watched many people, really, really, really struggle in it. And I struggled too. It's not to say that like obviously you don't struggle anymore. It's just you have a different relationship with the amount of emotional suffering and the like emotional magnitude
Mm-hmm.
of things that happen to you. Like I remember saying to both you and Lisa on a multitude of occasions, like this time last year, right? Like even just to talk about it now, like I was probably up. I think my mom was probably getting her second round of chemo around this time or something, right? And like even in the midst of it, like I would call you guys and I would tell you all about like the shit that was going on, and I was like, oh, this is so terrible and so horrible, but I'm okay.
Mm-hmm. I do remember that. I
I
remember
could,
us having some really authentic, we talked from the hospital even a couple times, like about you feeling like you were able to show up in a good way for your family. um, which takes a lot of resilience in those moments.
Well, and it came down to my awareness. Like it came down to like the fact that I understood I'm going to physically feel these ways. I'm going to mentally feel these ways. I can anticipate how I'm going to react to these situations. And I can acknowledge those experiences, not fully feel them, acknowledge them to the extent that I can, and then continue to show up in the moment in the way that I feel is appropriate and the way that I feel is like in alignment with my values and morals as I want to act.
That's
And
beautiful.
I don't think there's anything else you can ask for in that type of situation. Like,
And that's something you feel you would not have been able to do if you had not done this particular kind of therapy work. Yeah.
absolutely. There's no question. There's no question in my mind.
I love everything you just said. And you use the phrase like being in a different relationship with your suffering.
Yeah.
I think it's just a really kind of perfect way of describing, well, trauma treatment, effective trauma treatment, period. But a lot of what we do on ketamine work, and in your journey, it was a lot of trauma work that came up with your ketamine work, which is exactly what you said. It's not that your wounds go away, but you live in a different relationship with them. They don't, maybe, I don't know if this feels right to you, but I sometimes like they don't have their claws in you to the extent that they're controlling your lived experience moment to moment.
Yeah.
But so you have a little more agency in your relationship with it, but it's not like those things disappear.
Of course.
So I just like that you said that because it was realistic. It's realistic. Yeah. It's not like our trauma just evaporates and, it's like it's always part of you.
Oh, for sure. And I wouldn't have it any other way, right? Like, because ultimately all of these things that have happened to me, like, make me this very unique person that attracts so many people. And I'm able to have these really incredible, fruitful relationships with people because I'm able to show up so authentically. And I am one of the very few people in my life that I can say, like, almost definitively, like, when I leave everyone else behind, like my relationship with myself and my own internal experiences, like I am so fine. There's nothing that I have at the end of the day that comes to bother me. And like in terms of my relationships too, not only can I stiff arm them, but also like I don't have many relational problems with people anymore because I have so much awareness surrounding like what is their trauma and what is my trauma, and just like kind of being able to discern in that. So I feel like it also transferred just because of how well I guess I understood myself, that it helped me relate better or, like help my relationships with others too.
Wow. I love that. It's almost, I mean, if I had to put that in my lens, you might, use this words for yourself, but I saw you go through a lot of suffering and a lot of having to look at your hardest things and your scariest things. And I think that changes a person. I think it's a kind of initiation experience. It's not everyone in life is compelled or forced to do that. And so a lot of people never do that.
Yeah.
And I think you come out the other side of that with a kind of wisdom that's maybe what you're speaking to. You're using different language for it, where you are in a kind of a shift in perspective.
Yeah. All of that. Like once I got away from all of those incredibly traumatic and stressful and draining and just like frankly like soul crushing like environments and experiences, I did not know that life was so enjoyable, or even to a lesser degree that life had neutrality. Like I didn't know that it could just be neutral. And that's what I just can't emphasize enough to people, like people that were in shoes like mine, is that there is truthfully a whole life ahead of you. And it doesn't ever feel that way when you're in those times and places. And I just can't. It's so funny because as somebody who spent so much of their life so suicidal and really never expecting it to make it to my age, I cannot emphasize enough, just hold on until you have some more work towards your own autonomy, because it really does change your reality.
that needs to be heard, I think. I think there's a lot of people that need to hear that. I'm very glad that you spoke it. One thing that I think is compelling about your journey, but also just useful for people to know, is that like you've named these key points where ketamine was like played a crucial role or shifted a certain lever or something, right?
Yeah.
But this was not something where you got on ketamine multiple times and got to this place of recovery that you're describing now. It was also a lot of hard work that you were doing on all
Yeah.
kinds of ways with therapy support, also with other kinds of and that you engaged in. And so I actually like that you are saying that, because one of the misunderstandings of psychedelic assisted psychotherapy out there is that, oh, I'll go and I'll do this psychedelic experience and my pain and trauma will go away. And what you've said is more accurate. Sometimes you actually just get thrown more into your pain and trauma because now you're seeing it even more. And now you've got to do a lot of therapy work outside of the psychedelic experience to process that out. We call that integration, or to integrate it, right?
Yeah.
And that can be a big journey, right? So, and then you want a support team, you want to, support with it, but also the person that actually has to live that challenging experience day in, day out is you.
Yeah.
So it's almost like going into, I think it's important sometimes for people to hear, going into any kind of psychedelic work is you might be setting, you may, and there's huge amounts of difference with people. Some people, this is, ketamine work is very, very different. But what you're describing is not uncommon. And it's sometimes you're stepping into opening up things that you now are going to have to like, I sometimes use, I don't know if I ever said this to you, but sometimes I'll tell people it's like fighting your dragon. Like you're going to meet your dragon. What, I don't know, like it is going to be scary and hard. And nobody at the end of the day can do it except you. Like your team can support you in that process, but you have to feel and walk through all of that. And I think the value of the psychedelic aspect is showing you things that you don't see, which is, I think, what you've named. But it's important to know that that can happen and to have preparation. And then the shifting things in the body, which I think is a really, you've described a powerful example of like you named the book, The Body Keeps the Score, right? But this idea that a lot of trauma work happens on the level of the body itself.
Yeah.
So it may not even be something you're thinking about as a memory or a particular story. It may be that the body has to actually release something. And this is another thing that tends to happen more on psychedelic assisted psychotherapy. If it's facilitated, that has to be facilitated. I know that I'll just say for the sake of the interview that involved me like using physical contact in certain ways.
Right.
It probably wouldn't have happened without that. So there is a facilitation piece, but it's a very powerful way of working with psychedelic altered states. So one, seeing things that you didn't see before happens on psychedelics. And two, letting the body being able to shift, having some sort of ability to shift when it couldn't before. Those are two things that are definitely true and that I see a lot. And the third thing is what you have named, and I also saw you walk that journey of, which is you're still going to have to hold a lot of work and do a lot of, you know what I mean? There's just so much. Those things are parts of the process, but you are the one that has to do all the work through the process, right? So in other words, that's a lot of language because I like to make sure that people know that it's not a quick fix. It's not like you do a psychedelic session and now you're just better forever. It's not that. And so I'm trying to counter that narrative a little bit, educating people about it.
And that's the thing is that I think like, so that's the thing, right? It's there, whether we want to acknowledge it or appreciate it, it will exist regardless of whether or not you ever address it.
Mm-hmm.
And like, it's funny because as somebody who has been very fortunate that I've always had like a very strong work ethic as it pertains to like therapy, and like pursuing like my own mental health, I sometimes find myself like kind of scratching my head looking at people that are like, I don't want to face this, because I'm kind of like, I get that, but I'm also like, there's so much value in it, right?
anything that we haven't talked about that you think it would be important to say? Like if you were just talking out there to people who may be interested in this, what do you think they need to hear?
Um, like not only ketamine work, but just, any types of new therapies that like come about and that type of thing. I would say to people that I think the best thing you can do is keep an open mind and find a professional that you really trust and put your faith in those around you that make you feel seen and supported um and trust in those around you when you are in like those really, really, really intense periods of struggle, because that was ultimately what led me to the decision to do the ketamine.
Mm-hmm.
I had been seeing you for several years and my symptoms kind of reached to another breaking point and I really felt like I had nowhere else to go. And my mom and I were sitting around, what do we do? Um, and that's when we reached out to you and that's when this was suggested. And, we really were at our wits' end and just kind of took a blind leap of faith. Um, and that's not the only blind leap of faith that I took. But and ultimately, I guess maybe the other story that I'll share that I know this has impacted many people I've spoken with over the years, and it gives me chills thinking about this now. But when I was leaving to go to the woods the second time around, when I was 16 or 15 years old, and I was leaving like my outpatient therapist back in the DMV area, and like this is like when I had no one. I had nothing. I had no relationships. My life was a complete mess. And the only person I had any relationship with was this therapist that I was about to leave. And they let me call her from the mental hospital, from acute, before I left to go to the woods. And I remember sitting, like I can see the tile in the, hospital like hallway where I'm taking this phone call on this desk, like landline. And I call Jean and I just start sobbing. I'm just like, Jean, you don't understand. I can't leave you. I have no one. If I leave you, I will have nothing. I will never find enough, like just, I am completely beside myself.
Mm-hmm.
And she said to me, if you believe that this relationship is real and that the work that we have done is real and that the benefit that you have experienced from a relationship is real, you cannot believe that I am the only person out there like this.
Oh.
And it allowed me to continue to keep an open mind like throughout and I've told that story to many people over the years. And I was 15 years old when that was first told to me. And that is a huge part of what helped me keep the faith when I really felt like there was nowhere to turn, there was nowhere to go, was I was like, I have these people in my life that I trust. And I just have to lean on them in blind moments of support. Like you really just have to take a blind leap of faith. And this is a huge blind leap of faith. But if you're really interested in trying to reach a different place within yourself and have a different relationship with yourself and the things that have happened to you, it's absolutely worth the try.
So take the leap of faith, but not until you have a foundation of trust with the person you're working with.
For sure.
I think that's absolutely true because that's what creates safety.
Yeah.
Well, thank you for saying that. Thank you for taking the time today. I just want to say that even like while we're still recording, that we really, whoever listens to this in the future, we are super grateful for you just being willing to help educate and put information out there. You're not being compensated for this. You've taken your time and your energy and your resources to kind of share in this conversation. And so just want to pass my gratitude sincerely. And just on behalf of anybody who listens to this in the future, that for you, that's a gift. So I just appreciate that.
Of course, if it helps shift one person's mind or something, it's well beyond the time. So I cannot thank you enough as well. You know what I mean? Like you and your husband and concierge medicine and all it has done for me, it has absolutely saved my life. There's absolutely no question in my mind. And I'm more than happy to help support your guys' endeavors. So.
Well, thank you. It is kind of a crazy privilege to be doing this work. Every so often I look and I'm like, how is this my job? I don't know. Right. And you and I have talked about that a little. So,
yeah, I believe that.
All right. Well, I am super grateful. I'm gonna send this to you. Once we know what we're gonna do with this, I will
Yeah.
I'll send it to you so you can share it with anyone you want, or you can just know it's out there.
Yeah. No, I would love to see the end result. But yeah, thank you so much, Dr. Goldman. Talk to you later.
Thanks for listening to Living Medicine. We'll see you again next time. Be sure to click subscribe to get future episodes.